Good morning, members of the press. This is a communique issued by the Coalition of Health Professional Leadership in Katsina State with respect to the pandemic being experienced in the world of coronavirus, also known as COVID-19. It's no news, sadly, actually, that the coronavirus is being ravaging the world as we are speaking. Nigeria reported the first case on the 27th of February 2020. Though there is no case confirmed in Katsina State yet, the Coalition of Health Care Professionals in Katsina State, being the Nigerian Medical Association, the Pharmaceutical Society of Nigeria, the National Association of Nigerian Nurses and Midwives, the Association of Medical Laboratory Scientists of Nigeria, the Medical and Health Workers Union of Nigeria, have observations and recommendations. The leadership of these professional health bodies hereby notes the absence of some critical pillars in the COVID-19 task force. This has resulted in the absence of quarantine system, a system of quarantine, case evaluation, case isolation, and case management. We hereby, as leadership of the health professionals, also observe that we are not being involved in the state preparedness efforts against the COVID-19. We, however, have recommendations as follows. We call for the strict execution of the points of entry closure, that is the borders, provision of appropriately manned and equipped designated areas of quarantine at the entry points of Katsina State. We also recommend that the state government liaise with the National Center for Disease Control, the NCDC, in providing a testing laboratory in Katsina State with respect to COVID-19 virus. That we recommend should be by decentralizing the NCDC laboratory. Equipped isolation center or centers as it may to be provided devoid of existing hospital settings, of which we have unanimously identified the Katsina City Mall as well as the IDP camp that has been already on ground as suitable or alternative option. We also demand that personal protective equipments, also known as PPEs, like gowns, face masks, here the face mask, the N95 face masks, which are actually called respirators, and the ordinary face masks, hand gloves, boots, helmets, sanitizers, and other PPEs should be provided for the protection of healthcare personnel as well as their patients across facilities in Katsina State, so that healthcare workforce will give in its best. We also recommend that the activation of a special system for active case search and contact tracing with efficiently gadgeted ambulances for conveyance of suspects. The coalition will continue to engage the community via mass media engagements on the mode of prevention of COVID-19. We plead with the entire populace in Katsina State, the traditional institutions, the religious institutions, to abide by government's directives as it is in the best interest of all. Let the entire populace know that we actually have a war at hand. Collectively, we can win this war. Yes, as healthcare professionals, we took an oath. But however, our background training could only be optimal with matching arsenal. In conclusion, we pray that Allah subhanahu wa ta'ala see us through this war successfully.